Yeah. I think a collaborative approach between different disciplines only enriches the different point of view to be able to help us have a better understanding of any particular topic we are researching into. And this is going to help us to have a better result of all those investigations that different people are doing in order to work together to have a better intervention or come up with a better plan or an improved treatment to ultimately have better patient outcomes. I think that being within the same institution really helps us to network and get to know what other people may be doing at different places in order to work together and have, again, different perspectives to have a more holistic understanding of the issue that we are investigating or researching. I think that mental health research and quality of life research in our trauma patients is lacking, and this has the potential to not only impact directly the outcome of our patients in the short term, but has the potential to impact the long-term outcomes in our patients and their families. So the community ultimately will benefit from any progress that we can make in this arena. I think that it gives us the opportunity to know people in other disciplines, especially like mental health and, again, quality of life in our trauma patients. Like trauma patients and violence itself is a public health problem. So be able to approach this from the research and scientific point of view is very important because it helps us understand what's really happening to the patient. And once we understand and we work with behavioral science, with public health, with the clinicians, all these collaboration really help us to come up with better strategies, to come up with policies that can help us address these patient issues in a more holistic approach. So trauma patients have a really higher likelihood of developmental health issues after any traumatic experience, especially PTSD and depression. And with these mental health problems, patients have a long-term adverse outcome when it's left untreated. Once we have patients with these additional diagnoses in addition to their traumatic physical injuries, it really increases the societal burden because then they are less likely to become functional again, to get back to their work, which means they are going to be a burden to the society, to the family. They are going to increase the cost of the health care because they are going to require this additional complex management. So addressing this is really important and have the possibility to have an impact in another realm that we really are just now starting to explore. And once we do this and we get better understanding and better policies and improve patient care, we can definitely improve patients' life in every aspect, psychological and physical. We want patients to recover from their physical injuries, but we want them to be able to be functional again with their families, societies, the whole community. We want them to be able to get back to their lives, to get back to work, to be able to be productive within that environment, to actually have their lives back and be able to enjoy what they have after they have encountered such a traumatic event. Trauma itself, that experience, no matter what level of trauma it is, and each person reacts to trauma or responds to trauma in a different way, but it has proven to change the brain of that patient, just that experience. So this is how mental health actually has been shown and proven to be a consequence, a sequela of any physical trauma. trauma-informed care implementation also offers the opportunity to help us understand and recognize the impact of trauma in our patients. These offer the opportunities and give the skills to the healthcare providers to improve engagements, patients' compliance to the treatments. If we have more engaged patients, we are going to have more impact in any other treatment that we are providing for their injuries, and this ultimately can have the impact on decreasing hospital length of stay and also decreasing readmissions on our patients. So all these globally could also potentially decrease the healthcare cost of our trauma patients.